What is urinary urgency, and why does it cause bladder irritation? Imagine suddenly feeling a strong, urgent need to go to the bathroom that you can't ignore. That's what urinary urgency feels like. It is a sudden, intense desire to urinate that can happen even if your bladder isn't full. This sensation can be so overwhelming that it sometimes leads to involuntary leakage of urine, known as urgency incontinence. Unlike normal urges that gradually build, urinary urgency strikes quickly and can occur many times during the day or night. This condition happens because of changes in how the bladder functions. Normally, your bladder stores urine until it reaches a certain volume, at which point stretch receptors in the bladder will send signals to your brain that it's time to urinate. But in cases of urinary urgency, these receptors become overly sensitive or the bladder muscle contracts involuntarily. This means your bladder signals the need to urinate even when it isn't full, leading to that sudden, urgent feeling. Bladder irritation is closely connected to urinary urgency because many causes of urgency involve inflammation or irritation of the bladder lining and nearby tissues. For example, urinary tract infections cause inflammation of the bladder lining, which makes the nerves more sensitive and heightens the urge to go. Overactive bladder is another common cause, where the bladder muscle contracts involuntarily, often due to nerve issues or irritation, leading to frequent urgency and sometimes leakage. Physical irritants like bladder stones, tumors, or foreign objects can also physically irritate the bladder lining, causing swelling and reducing its elasticity. When the bladder lining swells or becomes inflamed, even small amounts of filling can stretch it and trigger discomfort and the urgent need to urinate. Inflammation can also affect a sensitive area near the bladder outlet called the trigone, which can further amplify the urgency sensation. From a bladder health perspective, urinary urgency is a sign that your bladder isn't functioning normally. It often indicates irritation or inflammation that can cause discomfort and impact your quality of life. Persistent bladder irritation and urgency can lead to emotional stress and social challenges. That's why it's important to identify the underlying cause, whether it's an infection, nerve issue, or other problem, and seek appropriate treatment. Proper diagnosis and management can help restore bladder health, reduce symptoms, and prevent complications like bladder damage or ongoing incontinence. In essence, urinary urgency is a sudden, compelling need to urinate caused by increased pressure or nerve sensitivity in the bladder. It causes irritation because many of its causes involve inflammation or abnormal muscle activity that reduce the bladder's capacity and cause discomfort during filling. If you experience frequent or severe urgency, consulting a healthcare professional is essential to determine the cause and find the best way to manage it. Remember, every person's situation is unique, and proper medical guidance is key to maintaining healthy bladder function.